Just wanted to mention a couple of things today about the NHS, because not everybody understands that there is some care support that you can receive for free via the NHS, and this isn't means tested. So some of the sort of help that you might be able to get is some equipment and home adaptations, help coming home from hospital, something they call NHS continuing healthcare, and some NHS-funded nursing care within a nursing home. So let's have a quick look at some of these issues. The free home adaptations and equipment. You might be entitled to some free home adaptations and equipment provided as long as they cost less than £1,000 each. And the sort of adaptations that you should be thinking about is handrails for stairs, grab rails within the bathroom, an intercom system for when people come to your front door, ramps for wheelchair access, maybe a walking frame, some perching stools for using in the kitchen and in the shower, and some heating improvements if it directly affects your medical condition. You can't have a heating upgraded. No, British Gas are not going to do that for free through the NHS. But if it is a medical issue that requires some form of heating improvement, then that could be achieved through the NHS. And how do you get it? Well, adult social services. That's where you go. A therapist will come to your home. They'll do an assessment and see what you need. And if the assessment finds that you need these changes to your home, and if the piece of equipment costs less than £1,000, the council must provide it free of charge. Do you hear what I said? If you're assessed and the improvements to your home, the changes, cost less than £1,000, the council must provide that for you. Okay. Are there any benefits that you can claim? Yes, you can look at things like attendance allowance and personal independence payments, PIPs. Again, these are not means tested. So if you're looking to explore any financial support, you might be eligible for a benefit or allowance. You have to fill in a few forms. And the sort of things that we need to be thinking about here is whether or not you're under state pension age. That's one form. If you're over state pension age, that's another form. Or if you're looking for some form of benefit for carers, that's another form. I'll put all the links to these forms, which can be very confusing, in the description below. So what help can you get after you come home from hospital? Because you may be eligible to free care and support in your home for a period of 6 weeks after a stay in hospital to prevent you needing to go into hospital again. So if you've been in hospital or they can keep you at home, preventing the need to go into hospital, or after you've been in hospital and come home, you've got this window there where you can actually get some support. This is called intermediate care or reablement. And the idea is to get you back as independent as possible, as quickly as possible as you were before. So we're again talking about those home adaptations, and it may be some help from a paid carer for tasks like cleaning. Nobody likes cleaning, especially when you're ill. But if you can't actually do it yourself because you're incapacitated in some way, you can get some cleaning support. Or maybe getting washed in the morning, getting dressed, using the toilet. Now, of course, that doesn't mean to say that you've got somebody living there 24/7 with you, but people will come and visit you and support you. I would say, though, from my understanding, that reablement is not necessarily available in all areas of the UK. Don't know why that is, but if you're looking for some form of support for reablement, that 6-week window, you need to look at speaking to your hospital discharge team, and the hospital staff can help arrange that with you. Because, let's be honest, nobody wants to be stuck in a hospital. And the hospitals need the beds. We talk about bed blocking a lot. So unless there's a good reason for you being in a hospital, if you want to go home, but you need a little bit of this extra support, then you should be speaking to the discharge team at the hospital saying, I want to go home, but I need a little bit of help. What can you do to help me? Otherwise, you might not be able to go home. What else should we be talking about? The NHS continuing healthcare. Let's think about that in a bit more detail. Continuing healthcare, that's a package of care you may be entitled to receive if you have a serious disability or illness, and this is an ongoing thing. So it covers the full cost. This is different from reablement. This is called continuing healthcare, and it covers the full cost of your care in your home or in a care home. So that's healthcare, personal care, care home fees. Different from reablement, 6 weeks, and then it stops. This is the continuing healthcare, which may be for many, many months or for the rest of your life. So you may be entitled to qualify for this NHS continuing healthcare if you have a primary health need. This means that the majority of care must involve managing your health rather than any form of social or personal care. Fine line between what we're talking about here. Again, you should be talking to the hospital. You should be talking to social workers and asking the question as to whether or not you are entitled to continuing health care. So how do I get it? Well, you have to speak to your GP, your social worker, or any healthcare professional, such as a district nurse, and you ask them if they can sort out for you the initial assessment, the initial screening process, to see whether or not you're entitled to the more detailed, full assessment. And if your health or health of somebody you care for is getting worse quickly, ask if you would be eligible for a fast track assessment. So deteriorating health quickly, you might be entitled to a fast track assessment. So there's all these different layers which are, but I'm trying to help untangle a little bit. I'll put a link below to the NHS continuing healthcare, so you can have a bit more of a read about that. And if we're looking at nursing in a care home, what does that mean? Well, the NHS will sometimes pay. There is this confusion, I think, that people think that the hospitals, NHS, looks after you from cradle to grave and will pay for everything. No, they won't. They will do for your medical needs, let's call it that. Yeah. Operations and medical needs. But when it comes down to social needs and some of your personal needs, then they're not actually going to be there to support you. That's dealt with through the local authority. If you don't have the money to pay, and there's a threshold that we've talked about in the past. But again, I'll put the links down in the conversation. If you've got the money, you have to pay for it. But if you are entitled to it, it could be paid for by the NHS in the nursing home. And the NHS-funded nursing care, they pay a flat rate, I believe this is the latest, a flat rate of £235.88 per week, directly to the nursing home to reimburse them for the nursing care that they're providing for you. That, therefore, will be reducing the amount that you may have to pay or the local authority might be paying on your behalf. And how do you get that? Well, you have to ask your nursing team, GP or social worker, to arrange for an assessment for the NHS funding for care. If you already have an assessment from the NHS for continuing healthcare, you'll not need to do a separate one. So again, nursing care in a nursing home, separate, not continuing healthcare, not the re-enablement care. But you need to go to the NHS-funded nursing care. Again, I'll put the link down below. So there you go. That's a quick run through of all of the little things that you might be looking to consider if you feel that the NHS could help in some way. We have to put all these things in the melting pot. As I said, it's very confusing. And at the Chasing Care podcast, what we're trying to do is untangle some of the mess. It's like putting everything in a tumble dryer, isn't it? And seeing it all go around and around and everybody telling you that you might be entitled to this, that, or the other. But what we've looked at today is care and support that you might be able to get for free through the NHS. If you enjoyed this episode today and found it useful, please click on the subscribe, like, and share. It's really important to us to help grow this community of people that are trying to help you understand the complexities of nursing, personal care, healthcare, social care, and the like. So that's it for the day.